So we talked previously about complications that can occur during TSW, the chronic hardened skin, which we've referred to, and chronic elephant skin. So do you think these complications occur quite often, or is it rare?
No, it's sadly, very, very sadly, it's common.
Yeah.
And also online, I see a lot of photos with people with chronic hardened skin and chronic elephant skin that they don't know what's happening and why they're not healing. I see it on every platform, so on the Facebook groups, but also on Instagram. I see sometimes people selling a certain type of moisturizers, and I see they have chronic hardened skin. So this is sadly also something that there's not enough knowledge yet, not enough education in the community, and it will take time to sink into the community. Again, this is a case, you know, it's not nice to tell that this chronic condition is there and that it might be a really complication during your TSW, but it's better to tell the truth so that it can be prevented in the future. Then, yeah, although it's hard to hear for people who are having chronic hardened skin at the moment. And it's a bit tricky because if people are going through TSW and at a certain point they start using the moisturizers, then in the beginning it can even look like your skin is doing better because it's creating this hardened layer on top.
Yeah.
So you think, my skin is getting thicker, but actually it's the hardened skin that starts the protection mechanism of the skin that starts reacting to the moisturizer.
Yeah.
And then you get this top layer, and at a certain point this top layer is so hard and thick and it cracks, and then it's difficult to stop with the moisturizers at all because it's very painful when it cracks.
Yeah.
So of course it's understandable that this happens. We just need more education into the community to avoid this condition. And there are very different severities in chronic hardened skin and chronic elephant skin. So this is also an important one because sometimes I saw some people posting information about chronic hardened skin. They learn about it, they post it in the TSW community, and then there are several people reacting, well, this must not be correct information because I had elephant skin and it went away by itself. And this is correct. You know, there are a lot of people who have temporarily elephant skin and it goes away by itself. But there are also in cases where people do something, there happens something to the skin, why the chronic hardened skin or elephant skin occurs, and without stopping this something, it will not heal. So this is in order prolonged scratching, which also happens on healthy, normal skin. If you prolong, you scratch, 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 you get skin complications. You get hardened, thickened layers as well.
Yeah.
Can also be prolonged irritant exposure in combination with scratching, or the moisturizing on a thinned and impaired skin as TSW skin. Like only light cases of TSW can use moisturizer safely when there is invisible flaking.
Yeah.
But for the other people, skin is impaired and open. There's also a big difference in how severe the chronic hardened skin or chronic elephant skin is. And this is also dose dependent and also depends on the type of moisturizers that has been used in case the cause of the hardened skin or elephant skin is moisturizing. So some people, they will have been moisturizing, let's say 2 times a day for 6 months, and then they change their mind, go into NMT or try something else. It will not be so severe as somebody that's been moisturizing 7 times a day for 2 years. It's a very different dose. And then also the type of moisturizer is important. If somebody has been using paraffin-based moisturizing, the problem is bigger than if they've been using something like coconut oil. And some lotions and creams have some ingredients that also cause even more problems to the skin. So there is different severity in chronic hardened skin as well. And for a lot of cases, it can be reversed 100%. But if the dose is really high and the type of moisturizer was really thick, then the chronic hardened skin may not be 100% reversible. It doesn't mean you can get a lot better, but sometimes it's not 100% reversible. And with the scratching and the prolonged irritant exposure, it's also like how long has it been going on?
Yeah.
If the scratching is not so long, the hardened skin will reverse. But if it's like, if it's going on for years and years, then it's more difficult to reverse.
Yeah. And I think this is important why we need this education up front. Like, you know, if you've been using steroids and you are going to make the decision to stop using steroids and you think you will go into TSW, this information needs to be available for people so that we can avoid these complications.
Yes, yeah. Even though the message is not nice, it's a painful message for the people who have this chronic condition right now. Also because you can have feelings of blame. You know, you did the moisturizer, you're moisturizing yourself.
Yes.
But it was only because you didn't have the knowledge and the education.
Yeah.
So even though the message is not nice, it's important to get out to the TSW community so we can prevent this happening in the future.
Yeah.